Everyone, welcome to the webinar. We'll just give a few more minutes for everyone to join. Okay, hi everyone. Welcome to the information webinar on the International Research Challenge on Women's Cardiovascular Health. This is an initiative from the Global Cardiovascular Research Funders Forum. We might just get started and move on to the next slide. Thank you. Hi everyone, my name is Stacey Matthews and I'm the project lead for the Women's Cardiovascular Health Initiative, working with the Global Cardiovascular Research Funders Forum. I'm based at the National Heart Foundation of Australia in Melbourne, and I will be helping today facilitating the webinar. I'm joined by panelists representing various GCRFF member organisations to present this webinar. We might just go around and introduce each of the panelists. I might hand over first to you, Christine.
Thank you, Stacey. Hi, everyone. My name is Christine Faubert, and I'm the Vice President for Health Equity and Mission Impact at the Heart and Stroke Foundation of Canada. So I'm based off Canada in Toronto, and I'm also the chair for the Women's Cardiovascular Health Research Initiative of the GCRFF. And I'll hand it over to Ryan.
Good evening, everyone. Ryan Perry, Vice President, Research and Science at the Heart and Stroke Foundation of Canada, also based in Canada on the western side of the country, and will be supporting the GCRFF International Research Challenge in terms of the application and review process. Adele?
Thank you, Ryan. My name is Hadil Kawar. I'm the Manager of Strategic Research Programs at the Heart and Stroke Foundation of Canada as well. My role is around overseeing the development, implementation, and post-award activities for our strategic research programs, and part of which this International Women's Challenge falls under. And I'll be talking a bit about the application process today. And I'll pass it over to you, Anne-Cécile.
Thank you, Adil. So I'm Anne-Cécile Defay. I'm the Associate Director of the Institute of Circulatory and Respiratory Health of the Canadian Institute of Health Research, based in Canada and in Montreal more specifically. And we are one of the partners on the GCRFF initiative.
Great, thanks everyone. So we might kick off and move on to the next slide. So today in this webinar, we will present an overview of the research program, the program requirements and eligibility criteria, details of the application process, assessment criteria, and peer review. We will finish with a live question and answers with our panel members. We might get started, and I'll hand it over to you, Anne-Cécile, to provide the program overview. Over to you, Anne-Cécile.
Thank you, Stacey. So we will start with a few background information on the GCRFF. If you want to, can we have the next slide, please? And the next one. Oh, thank you. So the Global Cardiovascular Research Funders Forum was founded in 2018, and it's a regroupment of international major cardiovascular research funders. Our mission is really to improve global cardiovascular health by accelerating, supporting, and promoting transformational international research efforts in heart, stroke, and circulatory disease. And you see at the bottom of the slide, you have the name of all the partners across the world. Next slide, please. So the overarching goal of this international research challenge that we are launching together is to support transformative research in women's cardiovascular health, focusing on one or more areas that represent an unmet medical need of global relevance. This funding opportunity is really structured as an international, multi-institutional and multidisciplinary research network grant that will bring together experts from around the world to collaboratively execute a research program delivering impacts that no single institution, country, or even continent could achieve on its own. We have 4 objectives for this program. New knowledge generation, addressing knowledge gaps in women's cardiovascular health that are of global relevance. Impact, driving transformational change in clinical practice, policies, and health outcomes for women globally. Innovation, catalyzing international collaboration and innovative research approaches, and capacity building, strengthening research network with engagement from researchers, clinicians, and early-stage investigators. Next slide, please. The International Research Challenge will accept applications that propose research programs in areas of women cardiovascular health that are under research or require greater understanding. You have here some research area of interest that include but are not limited to research related to risk factor and prevention of cardiovascular disease across women's life stages, research related to clinical diagnosis and treatment of conditions more prevalent or those with worse outcome, and research related to sex-specific underlying mechanism of cardiovascular disease in women. Next slide, please. Some timelines. So the deadline to send your letter of intent is January 15, 2025. Since it's across the world, we choose the Greenwich mean time here to give you an idea, but please make sure that you have the right time in your own country. The full application invitation is April 30. Full application deadline is September 15. And the notice of decision will be in January 2026 with a funding start date in May 2026. So that's it from me. I will now hand it over to Christine for the program requirements.
Thank you, Anne-Cécile. So we'll move now to the program requirements, starting with the eligibility criteria for the competition. So if we go on to the next slide, here I just want to go through the eligibility criteria in terms of the network composition. So if we look at the, based on the program description, the network must include 2 research program leads from any of the GCRFF member countries. And the research program leads are independent scientists, and it must be from 2 different continents. That's important. And at least one of the 2 must have a track record of leading international research teams. Then, in addition to the 2 research program leads, the network must also include a minimum of 2 co-applicants. And the co-applicants are also independent scientists who are contributing to the research and the network's activities. And they may be from actually any career stage, but we want to see at least one who's an early stage independent research investigator. And again, early career investigators are defined as in the guidelines or in the program description as scientists who are within 5 years of their first independent research investigator appointment. And then when we look at together, so research program leads and co-applicants, they must be from a minimum of 4 different GCRFF member organization countries. The GCRFF member countries are listed in the program description in section B17. Then the network can also include collaborators, so there's no minimum or maximum number required. And collaborators may include, but also are not limited to researchers, practitioners, people with lived and or living experience, policymakers, educators, community leaders, patient groups, etc. So collaborators are a really varied group, and they may be from GCRFF countries or not. And then trainees can also be part of the network, and they may range from various backgrounds, including undergraduate, graduate students, or postdoctoral research fellows. If we go on the next slide, I'm just going to go through some of the roles and responsibilities of the network members. So the 2 research program leads, they will be responsible for co-creating, executing, and leading the network research program. Basically, they're jointly responsible for overseeing the network governance, including facilitating decision-making and conflict resolution, or recruiting new members if as needed. And they will also overall coordinate the overall budget and submit progress reports on behalf of the network. And then, of course, they lead components of the research program. The co-applicants, they will also make a significant contribution to the intellectual direction of the research program. So they lead specific components of the research program, and they will be responsible for providing detailed scientific and budget reports for their part of the program. Then collaborators, as applicable, again, to the research program or activities, they can play different roles, so supporting, for example, research questions or design, but they can also provide various specialized services or resources, for example, by providing access to patient populations or access to special equipment or training. And they can also be knowledge users by collaborating on different dissemination or policy or practice uptake. And then trainees, if they're included, they will be responsible for participating in different research activities under the guidance of senior network members. If we go to the next slide, then I'll just finish in terms of the requirements for the network governance. So you will have seen in the program description that the network must develop what we call an administrative core, who's basically going to be responsible for the governance, decision-making, coordination, conflict resolution, and the oversight of the overall network. The research program lead, who has experience, again, leading international research team, will serve as the chair of the administrative core. And a requirement is that the administrative core include at a minimum the 2 research program leads, 1 co-applicant from each participating country, and at least 1 early stage independent research investigator. Then there's also requirements around, so the research program leads will be responsible for coordinating, preparing, and submitting annual progress reports and financial reports on behalf of the network and in collaboration with the institutions. And then there's just wanted to highlight one requirement around meetings. So the network will be asked to hold at least 1 annual meeting, of which 2 of the annual meetings will be in person, and also ensure meaningful engagement of all network members through the activities. So that's an overview of the program requirements. So I'll just now hand it over to you, Adil, for the application process.
Thank you, Christine. So for you who've probably seen the program description so far, you might have known that this funding opportunity is a 2-stage application process. And it includes a letter of intent, which we call LOI for short, and the full application stage. The Pretty much the biggest difference is that LOI is open to all applicants. So at the time when we launched the program on September 25, this is where it was already open. So some of you might have already started it, but the full application will be by invitation only. So I'll try to speak a little bit about both in more details to help bring more understanding. So next slide, please. So to submit an LOI, the designated research program lead is the one responsible for creating an account on Flux, and they would be the only network member with access to Flux. So we will not be able to provide more than one access to every different network member. So it's their responsibility at the time the LOI is completed, ready to be submitted, to also submit it on behalf of the network by the right deadline. Flux is, just to confirm, is the online grant portal managed by the Leduc Foundation on behalf of the GCRFF members. Once you create an account, you will just need to wait for a maximum of 2 business days, and then a confirmation notification will be received from Flux to your direct email with the right access details. So just in brief, to let you know what is expected from an LOI perspective. The designated research program lead will need to complete 4 sections of Flux. So the first section would be the project information. The second section will be around research program leads and their institution information. Third section is about the network members. And lastly, there's a section about some recommended reviewers for the application. On top of those sections, there are designated fields to upload 4 PDF files. So one would be the research proposal, and then there's another field for the bio sketches, a third for the letters of support, but that's just for collaborators. The bio sketches are for the research program leads, co-applicants, and collaborators who are research investigators. And the fourth field would be for the letters, for the disclosure forms. And this is for all network members expected to receive a budget from AHA or other GCRF member organization. Just be conscious, please, that all those individual biosketches, letter of support, or disclosure forms must be combined together into one single PDF file and then uploaded to system. So depending on where you are in the world, just make sure that the deadline is Wednesday, January 15, 2025, 8 p.m. GMT. And that's pretty much summarizes the LOI. So next slide, please. When it comes to the full application, so everybody, all applicants will be notified by email on the LOI decision. But if the LOI is selected by GCRFF to advance, the designated research program lead will be provided with the link with the full application instruction on Flux, and it will be the same login used during LOI, and it will be sent to the same person because it's expected it's the same person who will also submit the full application. And they will get a chance to complete and or update the project information sections on Flux. And they will be also asked to upload additional information, additional files. So instead of the research proposal, we will ask for a research plan, a combined detailed one. Any additional bio sketches, letters of support, disclosure forms, so the same applies. But also additionally, at this phase, we will be expecting network and institutional budget and budget justification. There will be an additional form presented available for you. So all the forms I've been mentioning, like the disclosure forms and the budget forms, will be available for you to download and complete. At the application stage, there's an additional document that will be provided, which is the research agreement. So there is no expectation to complete. It's just for you to share with your network members and their affiliated paid institution, and to notify GCRFF via Flux portal if there's any disputes that the members foresee arising with the research agreement. The application deadline would be Wednesday, September 15, 2025, 8 p.m. GMT. And following the submission of the full application, the designated research program lead will receive an on-screen and email messages from Flux confirming the application has been submitted. So please save this message just in case of anything. It will be helpful to have this submission if any problems with the submission. So that would be everything related to those two phases. And I will hand it over to Ryan to talk more about the process of review. So over to you, Ryan.
Thank you, Hidil. So I'll just take a few moments to go over the assessment criteria and peer review process for both at the letter of intent and full application stage. Next slide. So you will see in the program guide additional detail around the assessment criteria. They are outlined under 4 main themes. 1, transformative impact. The 2nd, research excellence. The 3rd, the network team. And then lastly, network governance. And under each one of those, there's additional detail in the program guide, such as for transformative impact, looking at how knowledge is being generated or mobilized, or the impact and significance of the question being addressed, innovation that's involved with the activity, as well as the capacity of the network to build and strengthen the environment in that space. For research excellence, looking at how the research aligns with the funding opportunity, the approach that is being taken in terms of originality, novelty, the clarity and quality of the proposed hypothesis and methodology, consideration around feasibility, as well as how various groups are being engaged in the research approach where appropriate, whether it be patients, people with lived experience, caregivers, community members, and other groups that would be seen to be adding value to the proposed activities. In terms of the network team, we'll assess the leadership and expertise of the team as a whole, how the team will be working together, so the collaborative approach for the network, considerations as it relates to equity, diversity, and inclusion in terms of the composition and the different perspectives and disciplines and sectors that are built into the network team, and then looking at the training and mentorship that will be provided and the appropriateness of the time and resources committed to mentorship, leadership development, and career support. And finally, around network governance, looking at the structure and decision-making for the network, how the network is going to communicate and work together, whether through internal and external communication activities and managing that along with conflict resolution, data management, and the approach that the network will take to manage, use, and protect data, including secondary data use as appropriate during the timeframe of the grant, and looking at considerations for sustainability beyond the grant funding. And then finally, around the resource allocation as it relates to decision-making and budget oversight. So these are the areas that will be assessed at the letter of intent, as well as the full application stage. Next slide. So the peer review process will include at time of receipt, so application deadline, those applications that are received, whether at the letter of intent or full application stage, they will undergo both an administrative review for both eligibility. So the eligibility is clearly outlined within the program guide, and as well as relevance to the funding mechanism. So to ensure alignment with the proposed activities, with the objectives and purpose of the International Research Challenge. And those that are deemed eligible and relevant will move forward for assessment by an international scientific review panel who will use the 4 areas of strategic importance that I had just outlined to assess and score applications. The after that process, based on the assessment by the International Scientific Review Panel, that will be used for the basis of the recommendation for funding to the GCRFF. Next slide. In terms of the composition of the International Scientific Research Panel, the panel will include a composition of experts from across the globe in various fields and perspectives, which include the scientific assessment of applications, and the scientific expertise will reflect various areas of women's cardiovascular health, and including the various research disciplines, whether it be basic or biomedical science, clinical research, healthcare systems and population health research, and relevant to the applications that are received for the competition. In addition, applications will be looked at by individuals with lived and living experience, understanding the engagement and inclusion and appropriate collaboration as appropriate for the proposed activity with individuals with lived and living experience. Looking at the governance and the network governance and how the governance is being established, and looking at the quality of that structure. Also, a consideration will be looked at in terms of intersectionality, looking through the lens of equity, diversity, and inclusion, as well as consideration for sex and gender-based analyses, depending on the proposed activities, and as well as inclusion both in the research team as well as within research participants, again, depending on the proposed program of research coming forward from the network. And finally, there will be a perspective and expertise around data management and the approach to data collection, use, and curation, along with the management of that data and the approaches that will be taken. Next slide. So with that, I'll pass that back to Stacy to take us through questions and answers.
All right. Thank you, Ryan. Thank you to our panelists for their presentation and providing an overview of the program requirements, application process, and assessment criteria and peer review. We hope that has covered some of the questions you may have about applying to the International Research Challenge. We do now have time for live questions and answers with our panelists. So please feel free to use the Q&A chat feature to send through your questions to us. I can see we've already got some questions coming through, which is fantastic. We will do our best to answer as many questions as we can, but if we don't get to your question now, we will respond to all questions and post them on our website. And you can always email questions at a later stage to research@heartandstroke.ca with the subject heading International Research Challenge. Also, you can read more information on the International Research Challenge Hub that is hosted by the British Heart Foundation, and the link is just provided on this slide. I might just start with the first question that we've got come through, and regarding whether the recording will be available. So we will be recording both of the webinars, and a recording will be available on our website for everyone to access when in their own time. We've got first a question about eligibility. Christine, would you be able to answer this question? Is the 5 years post PhD for earlier career researchers at the time of application or the time of commencement of the project?
Absolutely, thank you, Stacy. So that's a great question because it was not clear in the program description, but what matters is really the status at the time of application. So in this case, it would be at the time of submitting the LOI, so January 15 of this coming year.
Great, thanks. And I hope that's answered the attendees' question. I guess there's another question about eligibility. I might ask that to you as well, Christine. Can the same country be represented in both the team leads and co-applicants of the network?
Yes, Stacey, thank you. So that's a great question as well. So I've mentioned kind of like how diverse we want the network composition to be, like that's outlined in the guidelines. But yes, the same country can be from a research program lead and a co-applicant as well.
Great, and I guess it's a minimum of 4 GCRFF countries across the research program leads and co-applicants. Is that correct?
Yes, that's correct.
Yeah. Stella has sent through a question asking how extensive is the research proposal component of the letter of intent? Hadil, would you be able to answer that question for Stella?
Sure, Stacey, thank you. So first I'd like to mention, I think I missed this when I talked about the application and full letter of intent. On Flux, once you have an account created and you logged in, there are additional documentation that could be downloaded. One of them is the instructions related to LOI. So it does talk about everything in way more details. But to answer your questions now, the expectation would be around 7 pages for the LOI, and that includes figures, tables, but not including reference.
Thanks for that, Hadil. And we've got another question about the account for the LOI, and can it be created anytime before the 15th of January? Hadil, you might be able to answer this question about when the accounts can be created for the LOI.
Yes, for sure, Stacey. So yes, and anytime. So since we launched on September 25, this has been available, and it will be available until the 15th. But we absolutely do recommend people not to wait until then or just a few weeks before, because there are so many sections to fill and many documents to complete and attach, and probably some signatures. So the earliest you start by creating your account and starting the work on the LOI, the better. This is what we recommend.
Great, thanks, Hadil. We just got another question on can someone elaborate on the difference between the research proposal at the LOI stage versus the full application stage? Ryan, would you be able to elaborate at all on the difference between the LOI stage and the full application stage?
Sure, I'm happy to take that, Stacey. So at the letter of intent stage, as outlined, that is provides a brief overview, 7 pages around and the allocation of pages or the recommended allocation of pages to each of the criteria is provided. And really focusing on at the LOI stage is the transformative nature of the work, recognizing that there's not going to be a lot of space to really detail the methodology, but at least outline the approaches that you're looking to take and sort of give a sense to the committee around the feasibility of taking that forward and those involved. At the those invited for full application will have 17 pages then to really flush out all of the additional details to the scope of the activities and go deeper into the methodology and the approaches and the various roles of the teams involved. But I'd encourage you to, as you prepare your application, look through both the guidelines at the letter of intent stage, because there's some helpful information to help provide you some guidance in how to structure and put forward a letter of intent for the competition.
Great, thank you, Ryan, for answering that question. We've got another question on the letter of intent from Leslie. How many pages? So I think we've covered about 7 pages for the letter of intent. Hadil covered that. So I guess there was another question here from Rebecca about eligibility. Christine, you might be able to answer this. Can research associates, i.e. postdocs, but pre-faculty, be co-applicants?
Thank you, Stacy. I would have to go back to the guidelines document. I believe they are, but maybe we'll just kind of like clarify in the Q&A, unless, I don't know if others on the call, Ryan or Adil or Anne-Cecile, would be able to answer here. I just want to make sure I'm providing the right information.
In terms of eligibility at the co-applicants. So co-applicants, when you read through the definition of a co-applicant, that is someone that is eligible to hold grant funding at their institution. So if you are in a position to hold funding as a researcher at the institution, generally that is someone that has an independent research appointment, and that's how we've structured the definition. So in that case, research associates in general wouldn't be eligible to apply as a co-applicant, but doesn't eliminate the opportunity to participate as a collaborator in some other way on an application.
Great, thank you. Thanks for answering that question. I've got another question. Will there be a normalization of number of eligible applicants that go on past the LOI stage for equal representation of all applying funding countries? Ryan, do you think you could answer that question for Thalia?
So in terms of when we went through the assessment of the letter of intent, the letter of intents will be ranked based on the criteria that was identified as assessed by the International Scientific Review Panel. That as part of that rubric, there is not a consideration for normalization across countries involved in the competition. It's really about those letters of intent that come forward that best align with the assessment criteria as outlined for the International Research Challenge Grant opportunity. So hopefully that helps provide clarity on that particular question.
Thank you, Ryan. So there's a question about from Sue Lim. Would it be seen favorable or unfavorable if the work is carried out in low and middle income countries as well as in GCRFF countries? Christine, do you think you could answer that question?
Yes, thank you, Stacey. I can answer that question. That's a great question. So we're in the guidelines. Low and middle income countries are eligible to join as collaborators, and then I think we've outlined clearly that the research area, we're really trying to reach different goals as Anne-Cecile has outlined, and we're really looking for international applicability with global relevance. And so depending on, again, the research question and the research program that would be proposed, like the peer review panel will really assess the overall program and network composition and collaborators with regards to that. So I guess that's what I can say for now.
Great, thank you. Now we might just move on to another question. So Akira has asked, collaborations among the US, Japan, and 2 developing countries, is this design eligible? Christine, this is a bit similar to the last question. Would you mind answering this one as well?
Yes, absolutely. Thank you, Stacy. So in this case, again, going back to our composition requirements for the network, we would need to have a research program lead and co-applicants who are from more than, so US is currently a partner of the GCRFF, but Japan is not, and low and middle income countries are not as well. So there would need to be 3 additional partners on the network as research program leads and co-applicants that are from our GCRFF countries. And again, the list of the countries that are members of the GCRFF are in section, I think I mentioned earlier, section, let me just see quickly. Here, I think it's section, yes, I have it here, B17. So it's at the end of the program description. So there would be some needs to have new network eligible.
Great, thanks so much for answering that, Christine. We've got a question from Constance. I think, Ryan, you might be able to answer this question. I am an independent young researcher without a team. Is there a platform to connect with other potentially like-minded individuals to build such a team?
Thanks for that
Ryan?
question.
Yeah.
So at this time, there isn't a platform available for partnering. But that's something that we can bring back for further discussion about what might be applicable or feasible to develop between now and the LOI application deadline. But at this particular time, there isn't that mechanism available.
Great, thank you, Ryan. There's another question from Stella. This one might be for you, Hadil. Is an outline of the proposal components available? And I think this might be relating to the LOI.
Yes, it is. So as I mentioned a bit earlier, there on Flux, you will have a section to download multiple documents, including the program description, but there's also a separate one for the letter of intent instruction. And this document is fully detailed and explains every component and the expectation for the letter of intent.
Thank you. We now have a question about maybe this one's for you, Christine. Can you describe some examples of previously funded applications? So e.g. their proposed research team makeup, etc.
Yeah, that's a great question. This is the first research computational program from the GCRFF. So we don't have like a history of having funded other proposal before in the context of a previous competition. So this is really a first experience for the GCRFF, even though it might not be the first program that's looking at, broader type of like research network grants like this one. But us as an entity, we don't have that past experience.
Okay, thank you. Thanks, Christine. Yes, this is a first time grant, so that we don't have previous examples. There's another question about the Flux portal. I might just ask you this one, Hadil. Do research officers have visibility of the application in Flux?
Thank you, Stacy. So as I mentioned, there will be only one access or one login provided to Flux, and this is for the lead. So nobody else would have the option to log in and to Flux. Now, if the lead, I don't know, work together with somebody while logging in, that's a different story. But in terms of a direct access and visibility, so the answer is no, it's just the one.
Okay, thanks, Adil, for answering that. Yep, so we just have one person with the login able to access the application. So there is a question from Anastasia. Might ask this one to you, Christine. What period of funding is it, and what is the funding limit?
Thank you, Stacey, for the question. I just want to make sure I understand, but period of funding. So this grant is for a term of 5 years, and there's a 1 year no cost extension, and the funding limit is up to $10 million US in terms of value. So I don't know if this answered the question, and if it doesn't, just let me know, and I can provide more information. Thank you.
Thanks so much, Christine. So we've got a question about ethics. Ryan, perhaps you can answer this question. So when applying for ethics, have you encountered problems with single gender applications, and how have you handled these questions?
So that's a great question for your ethics department at your local site. In terms of the funding mechanism, the mechanism is focused on understanding, furthering the understanding of women's health and cardiovascular health, and so looking at how that aligns with your local ethics requirements, I think would be helpful for you to reach out to your local ethics group to figure out the proposed activities that you're bringing forward, how that aligns with your local context.
Great, thanks so much, Ryan, for providing that information. We've got, so there's a question from Christina about the LOI. I might just ask Hadil this. Very helpful webinar. Thanks, Christine. Glad it's helpful to you. Are there formal requirements for the letter of intent regarding the length of content, number of figures, and tables?
Thank you, Stacey. Yeah, I think, as I mentioned again, the document related to the LOI instructions have those details. So I'll just maybe quickly say a few so that people understand what kind of details I'm referring to when I say it's available there. So for example, text must be single space, no more than 6 lines of type per 2.54 centimeter or 1 inch. All pages must be 8.5 inch, like no acronyms, any acronyms and abbreviations, sorry, must be explained at the first use. So all those kind of instructions and way more are there on that document once you're into Flux and you're able to download it. If I go through them, I think I might be it's gonna take a lot of time. So I'd like to keep time for other questions. So just make sure you do download this document. And I guarantee you it will answer all those questions. And then again, there's always we're always there. There is an email that we will be providing you at the end of the webinar for any additional questions that you may still need while applying and submitting your LOI.
Great, thanks so much, Adil. This is a very good question. I think, Christine, you might be best placed to answer this one. So why is there only one award for such an important health concern affecting half of the population?
Thank you, Stacey. Yes, that's a great question. So again, I mentioned earlier that the GCRFF is a relatively young group, and this is going to be the first joint research program that we're launching together or doing together. So we decided to fund only one grant in this case because of that first initial experience. It's not going to be the last, but the future opportunities might not be necessarily in the women's cardiovascular health space. but we thought it was important to start to fund at least one in this case. Start with one and try to learn from the process. And we didn't want to split the amount because of the international and really kind of a global nature of the network that we are aiming to create through our objectives. So that's why we're limiting to one currently.
Great, thanks so much, Christine. I hope that answers the question. Here's another question about the approximate number or percentage of LOIs that will move forward to invited full applications. Ryan, would you mind answering how many LOIs will move forward to the full application stage?
Stacy. So in consideration and building off the last response, that this is really focused on funding one international network to address women's health in the cardiovascular space. We will be looking to invite up to a maximum of 6 letters of intent to move forward to a full application phase, and that we thought was the right balance between the expected funding of one network and the amount of work that would take to develop full applications. So up to a maximum of 6 letters of intent will be considered to come forward for invitation to submit a full application.
Great. Thanks so much, Ryan, for confirming the number of LOIs that will progress to full applications. There's another question come through about feedback on the LOIs. So is maybe, Ryan, you're best placed to answer this question. Is there going to be feedback from reviewers at the LOI stage for those proposals that make it to the second stage?
So we are committing to provide the written feedback from the committee discussion on LOIs to everyone, and then those that are invited forward to submit a full application will also be provided independent reviews with additional details on the assessment of their LOI to help support the preparation of a full application.
Great, thanks so much, Ryan, for providing that clarification on feedback. Christine, there's just a question about eligibility. Could you answer this? So could you please clarify the international investigator requirement for the PI?
Yes, thank you, Stacy, for the question. So again, the network composition, the network must include researchers, so 2 research program leads and a minimum of 2 co-applicants. And so they're all leading components of the program of the research network. And together they must be from a minimum of 4 countries where there's an organization from the GCRFF members. I can maybe list quickly those countries. We're talking about Australia, Bahamas, Canada, Denmark, Germany, Great Britain, Netherlands, New Zealand, Switzerland, and the US. So at least 4 members from those countries. And then the 2 research program leads must be from 2 different continents, because we really want to see sharing the leadership around the globe. And then there can be other additional co-applicants or collaborators and trainees from any countries in the world.
Great, thanks, Christine. We've got another question about the submitting of applications. Are RAOs able to start a dummy application? Hadil, would you be able to answer this question about submitting applications?
I can try. Like I don't think the answer would be a no. Like honestly, anybody is able to go on the Leduc Foundation and create or ask to create an account. Now, I'm not sure about the Leduc Foundation policies, like how do they check and vet for the information they receive? So, and is it based on that they do create the logins or not? So I would recommend emailing them directly, and we will be providing you, I mean, or maybe everybody can see right now. You could directly email them to confirm, but technically anybody could try and create an account. So if they do succeed, then the answer would be yes.
Okay, thanks, Hadil. There's a question about the topic. Christine, I might ask you this one. Is the proposal limited to preclinical research or translational research?
Thank you, Stacey. Yeah, that's a great question. So I think, Ancestor, you mentioned we're really opening up this competition to a scope of any research related to women's cardiovascular health. So any pillars of health research. So we're inviting, basic biomedical, clinical, health sciences, population health, any project that, and then it's up to the applicants to show to what extent what they're proposing is an area of unmet clinical needs. So it's really open. We've only identified 3 areas of special interest, but it's really open to any topic related to women's cardiovascular health.
Great, thanks so much for that, Christine, clarifying the topic for the International Research Challenge and the types of science that will be funded. We've got another question. So is the $1 million USD for multiple applications, or will one application be funded? Ryan, do you think you could respond to that question?
Stacey, yeah, just to stress again that there is going to be one network application funded up to $10 million US. And so this is not going to be split among multiple awards. It's a single grant to the network that's determined, that the recommended network for funding in that full amount of up to $10 million US.
Great, thanks so much, Ryan. So there's a question from Cynthia asking, are there specific guidelines available for the full application without having to create an account? I wonder if, Ryan, you'd be able to respond to that question.
Thanks, Stacey. That's a good question, and I'm not sure if I'm best placed to answer on the Flux system. Is once you get on the system, if you're able to see the full process. I'm not sure, Hadil, perhaps you may be aware, or we may need to take that back for clarification.
Thank you, Ryan. Yeah, I mean, we can also always follow up, and we'll make sure this question, and maybe this is just to clarify regarding all the questions that we answered today, and any we might not be able to answer, we will be providing an FAQ document. So everything will eventually, we will try to have all the answers eventually after both webinars. But no, so far I would not say there is something specific about that, but we are working on something. So it probably might be available at some point even before the deadline of LOI. So keep an eye, and we will make sure this is part of the FAQ question to answer. But also you can feel free to email Leduc directly and ask this from them.
Thank you. Yeah, we'll take on board that question, and we will come back to you with an answer. So I guess we're just coming to time now, and we've answered around I think 27 questions, but I can see there is still more. But we will answer all of the questions, and we will post them on our website and make them available to you all. I just want to say thank you to all our panelists for presenting and answering questions about the grant and A big thank you to everyone for attending and showing interest in the International Research Challenge on Women's Cardiovascular Health. We really hope that this informational webinar has answered any of your questions, and we look forward to receiving your research proposals soon. Thank you, everyone.